Welcome back and thank you for subscribing to my class. And for those who did not subscribe yet, please be generous naman to click the subscribe button. Same with the bell for the notification. And if this is your first time to attend, welcome to Dr. Krell's online class. Thank you for being with me as of this moment. Okay? So our topic is about respiratory failure. We will discuss the definition, the risk factors, the pathophysiology, the clinical manifestations and diagnostic procedures, medical management, and nursing management. So at the end of the discussion, we have a few questions to answer. So we'll try to analyze the question to get the correct answer. By the way, the contents of the discussion were taken from different MS Nursing textbook, and some photos in the slides are not mine. I took it from different websites, and I don't have the intention to claim it, and I don't own the rights. So, sit back, relax, and learn from the discussion. Oops! If you find it informative, do like, share, and subscribe to my channel. Okay? Let's start. So, ayan, respiratory failure. Sudden and life-threatening deterioration of the gas exchange function of the lungs and indicates failure. Okay? Indicates failure of the lungs to provide adequate oxygenation or ventilation for the blood. So, ayun. Actually, we have acute respiratory failure and we have chronic respiratory failure. So when we see acute respiratory failure, there's a decrease in arterial oxygen tension. Okay? So at less than 60. Okay? 60 millimeter mercury, or pag si patient ay na-observe na natin na meron na siyang hypoxemia. Okay? And also, dito din sa ating acute respiratory failure, there is also this increase in arterial carbon dioxide tension. Okay? 2 greater than 50 naman. 50 millimeter mercury. Or pag si patient na na-observe natin na meron na siyang hypercapnia. Okay? At with arterial pH of less than 7.35. So, that is considered acute respiratory failure. Pag chronic respiratory failure, okay, as deterioration in the gas exchange function of the lungs that has developed, okay, insidiously or has persistent for a long period after an episodes of acute respiratory failure. Okay? So, walang mangyayaring chronic respiratory failure kung hindi siya nagdaan sa mahabang panahon ng acute respiratory failure. Okay? So, go na tayo sa ating pathophysiology. So, in acute respiratory failure, the ventilation or perfusion mechanisms in the lungs are impaired. Okay? So, the ventilatory failure mechanisms leads to acute respiratory failure. That includes impaired function of the central nervous system. So, if there is impaired in the central nervous system, example dito yung drug overdose. Okay? Ano pa? Merong head trauma. Okay? What else? Infection. Ganda ng sulat ko. Bagong gising lang. Hemorrhage. Nag-explain na bagong gising. Hemorrhage. Ano pa? Sleep apnea. Okay? So, yan. Pag impaired central nervous system, it is due to drug overdose, head trauma, infection, hemorrhage, and sleep apnea. What else? That also includes the musculoskeletal dysfunction. So, ano naman sa skeletal dysfunction? Halimbawa, puno na. Saan natin magsusulat? Halimbawa, merong chest trauma. Okay? Ano pa? Malnutrition. So, malnutrition dyan. And what else? What to include? Neuromuscular dysfunction. So, for the neuromuscular dysfunction, yung common, myasthenia gravis, no? Ano pa kaya? And that also includes pulmonary dysfunction, yung merong mga COPD, no? Merong mga asthma. Yan. Cystic fibrosis kasama din. So, yan, ha? And another then is oxygenation failure. Okay? Pag bawa merong oxygenation failure mechanisms that leads to acute respiratory failure. That includes pneumonia, acute respiratory distress syndrome or yung ARDS, and heart failure, COPD, pulmonary embolism, and restricted lung disease. Okay? So, restrictive lung disease, these are diseases that cause decrease in lung volume. Okay? Letter C. Okay? So, in the post-operative period, especially after major thoracic or abdominal surgery, so inadequate ventilation and respiratory failure may occur because of several factors. Okay? So during this period, for example, an acute respiratory failure may be caused by the effect of anesthesia. Okay? Effect of anesthesia or anesthetic, analgesic, and sedative agent, which may depress respiration. So, as prescribed earlier din sa definition natin. Or, enhance the effect of opioids and leads to hypoventilation. Okay? So, yan. And for the clinical manifestations, I first here will see the difference between the normal lungs at yung merong conditions causing respiratory failure. See, dito sa ating normal lungs, kung nakikita nyo to, ayan, wala siya dito. At this, wala din siya dito. Okay? So, conditions causing respiratory failure, like kung halimbawa, condition that affects the blood flow of blood in the lungs, so pulmonary embolisms. Okay? So, kasama siya, diba, kanina sa ating pathophysiology that may cause, ba? So, pulmonary embolisms that blocks blood flow and causes lung damage. Conditions that affect the nerves and muscle that control breathing, so muscular dystrophy. Okay? Pag condition naman that affect the areas of the brain, pag sa patient is merong stroke or drug alcohol overdose. Conditions that affect the flow of air in and out of the lungs, kung si patient is merong COPD or cystic fibrosis. Okay? Pag naman, conditions that affect gas exchange in the alveoli, so merong acute respiratory distress syndrome and pneumonia. Ayan, ang ganda nito. Thank you, nakuha ko lang siya sa website. Thank you doon sa nag-share nito at nakuha ko siya. So, ayan, for the clinical manifestations, the early signs. Yan, early signs that associated with impaired oxygenation may include restlessness, fatigue, headache, dyspnea, air hunger, tachycardia, and increased blood pressure. So, these are the early sign. Okay? Early signs. And as hypoxemia progresses, more obvious signs may be present. That includes confusion, lethargy, tachycardia, tachypnea, central cyanosis, diaphoresis, and respiratory arrest na kung hindi na talaga siya na-carry. Okay? And ito, pag nag-progress na yung kanyang pagkaroon ng hypoxemia. Naalala nyo kanina sa ating description ng acute respiratory failure, di ba? So, ayun. So, physical findings are those of acute respiratory distress that includes use of accessory muscle and decreased breath sounds if the patient cannot adequately ventilate, di ba? And other findings related specifically to the underlying disease, process, and cause of acute respiratory failure. So, yan. And for the medical management, actually, the objective of treatment are to correct the underlying cause and to restore adequate gas exchange in the lungs. So, for the medical management, this endotracheal intubation and mechanical ventilation may be required to maintain adequate ventilation and oxygenation while the underlying cause is corrected. Okay? So, for our part naman, includes assisting with intubation, of course, and maintaining mechanical ventilation. So, patients are usually managed in the ICU. Okay? So, yun. So, the nurse assesses the patient's respiratory status by monitoring the level of responsiveness. Okay? And arterial blood gases, pulse oximetry, and vital signs. Okay? So, in addition, the nurse assesses also the entire respiratory system. Okay? And implements strategies like what? Turning schedules, mouth care, skin care, and range of motion of extremities. Anon. That is to prevent complication. And what else? The nurse also assesses the patient's understanding of the management strategies, di ba? And strategies that are used, di ba? And initiates some form of communication to enable the patient to what? Express concerns and needs to the healthcare team. Okay, ang dami ko ng to na sinabi. Finally, the nurse addresses the problems that lead to the correct respiratory failure. Okay? So, as the patient's status improve, the nurse assesses the patient's knowledge of the underlying disorder and provides education, 'di ba, as appropriate to address the disorder. So, yan. So, any question or if you have any additional nursing management, kindly write it in the comment section for the benefit of everybody. Okay? So, we'll start na ng ating review questions. A patient present in the emergency department stating she was in a boating accident about 3 hours ago. Now, the patient has complained of headache, fatigue, and the feeling that he just can't breathe enough. So the nurse notes that the patient is restless and tachycardic with an elevated blood pressure. So the patient may be in the early stage of what? Respiratory problem. Pneumoconiosis, pleural effusion, acute respiratory failure, and pneumonia. Okay? So 1 minute. 5, 4, 3, 2, 1. Okay. Answer is acute respiratory failure. Okay? So the early signs of acute respiratory failure are those associated with impaired oxygenation, di ba? And may include restlessness, fatigue, headache, dyspnea, air hunger, di ba yung mga nasabi natin kanina sa ating clinical manifestations, okay? Tachycardia, increased blood pressure, yan. So, as the hypoxemia progresses, more obvious signs may be present, di ba? Tachycardia, di ba? Central cyanosis, yan. And finally, respiratory arrest, di ba? Yun yung sabi natin kanina. So, ayun. So, next question. The nurse is caring for a patient who has just returned to the unit after a colon resection. The patient is showing signs of hypoxia. So the nurse knows that this is probably caused by what? Nitrogen narcosis, infection, impaired diffusion, and shunting. So, 1 minute. Three, two, one. Okay, time is up. Answer is D. Okay, shunting. So shunting appears to be the main cause of hypoxia after thoracic or abdominal surgery and most types of respiratory failure. If you still remember, we included it in our pathophysiology, the letter C, di ba? Yung mga after thoracic or abdominal surgery, what happened? It's because of what, right? So, ayan. So, impairment of normal diffusion is less common cause, lalo naman sa infection. Infection would not likely to present at this early stage of recovery. And yung nitrogen narcosis natin only occurs from breathing compressed air. Okay? So, next question tayo. A patient who involved in a workplace accident suffered a penetrating wound of the chest that led to acute respiratory failure. What goal of treatment should the nurse team prioritize when planning this patient care? So, A, facilitation of long-term intubation. B, restoration of adequate gas exchange. Attainment of effective coping. And self-management of oxygenation. So, time starts now. Okay, time stops. Answer is B. Okay, so restoration of adequate gas exchange. So, actually, the objective, di ba, sinabi natin kanina sa discussion natin sa ating nursing management, the objective of treatment are to correct the underlying cause of respiratory failure and to restore adequate gas exchange in the lungs. So, this is the priority over coping and self-care. Long-term ventilation may or may not be indicated. So, ayon. So, the pinaka prioritize na goal of treatment natin is the restoration of adequate gas exchange. Next question. A patient is brought to the emergency department by ambulance after a motor vehicular accident in which the patient received blunt trauma to the chest. So, the patient is an acute respiratory failure. Saan ako? Is intubated and is transferred to the ICU. What parameters of care should the nurse monitor most closely? Select all that applies. Ayan, coping, level of consciousness, oral intake, arterial blood gas, and vital signs. 1 minute. Okay, time stops. Okay, dito sa question, if you still remember dun sa discussion natin kanina, di ba? Nasabi natin, patients are usually treated in the ICU pag merong respiratory failure. Okay, what is the answer? B, D, and E. Level of consciousness, arterial blood gases, and vital signs. So, the nurse assesses the patient's respiratory status, di ba? By monitoring the level of responsiveness. Ayan, kasama yan natin kanina sa ating mga nursing management, di ba? Yung ating mga arterial blood gases, pulse oximetry, and vital signs, di ba? And yung oral intake and coping are not immediate priorities during the acute stage of treatment, but would become more important later during the recovery. Pero based dito sa question natin, ito munang level of consciousness, arterial blood gases, and vital signs. Okay, our last question. A nurse is creating a health promotion intervention focused on chronic obstructive pulmonary disease. So, what should the nurse identify as a complication of COPD? O bakit na isama natin dito si COPD? Because, mamaya sagutin natin. A. Lung cancer, cystic fibrosis, respiratory failure, and hemothorax. So, 1 minute. Two, one, stops. Ayun. So, if you still remember, doon sa pathophysiology natin, sa letter A, di ba meron tayo doon yung last, yung pulmonary dysfunction, di ba? So, in the pulmonary dysfunctions, that includes the COPD. So, complication of COPD includes respiratory failure. Okay? Ano pa? Respiratory failure, pneumothorax, atelectasis, pneumonia. Yung isa na yung yung pulmonary hypertension, yun na lang. Pulmonary hypertension, yung ating lung cancer, cystic fibrosis, hemothorax are not a common complication. Okay? So, because this is our last question, so thank you for watching, class. And if you find it informative, do like, share, and subscribe to my channel. And as of now, bye-bye. Be safe all the time. Mwah, mwah.